morning, Jennifer Shepard with the Shepherd Center for Integrative Health. This morning I want to talk to you about narcolepsy. So in my clinic, I treat patients who, complicated patients. I mean, I treat, yes, ankle pain, back pain, that's super fun to do, a broken toe, love that. But what I really enjoy and where my skill set lies is in treating really complex patients with multi-system involvement, diagnoses, and complex problems where I just got an email the other day who said, I've been through clinical functional medicine, I've been through this, I've been through that, I've been everywhere. And what makes our work different, those of us who practice at this level with this integrative manual physical therapy, trauma compensation theory, again, just all of the study that we've incorporated throughout our careers and the training we've done with our hands. So as we incorporate all of this into problem solving, that is our wheelhouse, is, hey, what's happened here? Here's their body. What's going on? What do we notice? What's happened to the body throughout a lifetime? So back to narcolepsy. So I've never treated narcolepsy. Honestly, I don't know a lot about it. So as I talked to this patient's mother, I was honest. Hey, here's what I need you to help me understand. Here's where I will go. Here's what we're going to problem solve. I want to understand why. I want to understand what happened. I want to understand the chemistry. I want to understand the brain structures that are involved with this. I know quite a bit about sleep cycles. I'm by no means an expert, but I do know, right? Throughout the evening, we cycle in and out of our deep sleep, our REM sleep, our REM sleep, and light sleep. So we're always in efficient sleep is cycling in and out. I'm very familiar with, again, the wavelengths, right? The delta waves, theta waves, alpha waves. So again, these arousal states in the brain, which all come together to, I'm going to come into regulate, right? To regulate circadian rhythms, regulate brain rhythms. So very simply, so narcolepsy is, and I'm not going to be able to speak to it as eloquently as I like because I'm still learning as well. But what I know, and again, please correct me, anybody out there, if I do speak incorrectly or miss a point, that's important. But again, chemistry involved, a beta creatine perhaps, and then there was another chemical that I came across as I was reading Matthew Walker's book, Why We Sleep. And the brain is unable, or the brain spends most of its time in REM sleep. And that's what happens, I guess, throughout the night. It spends most of the time in REM sleep, and then during the day, it kicks into REM sleep, I guess, very quickly. Again, like I said, I'm still learning. So as I talked to this patient, I said, here's what we're going to look at. Here's what I'm curious about. So this patient, when the patient was young, a young boy around the age of 7, had a vaccine, a flu vaccine, and an H1N1 vaccine. And a couple months after that is when the narcolepsy began. So the thought was, again, whatever components of that vaccine created an immune response, but almost an autoimmune response to whichever part of the brain was making the chemical needed to help the brain get in and out of REM sleep, or to get it out of REM sleep. So thinking about that, our gift, right? So we problem solve what happened throughout a lifetime. And then what do we feel with our hands? So also thinking, because the patient also wanted, how do I take better care of myself while I have this disease? You hate to call it a disease, but whatever you want to call it, this patient has a disruption in his sleep, and it's called narcolepsy, and it affects his life. So he's on ADHD medication, which helps him. But however, there's side effects that come with that medication. There's side effects that come with the imbalance of the brain chemistry. So how can he live healthier? So again, thinking with functional medicine eyes too, how can I guide him? But I'm most interested in what's going on in his brain. What do I feel? So we jump right in. General listening took me into the cranium, almost actually took me into more of an emotional listening. So then from there, we get right on the table, and I go, right, I want to feel craniosacral rhythm. Again, the fluid dynamics, I want to feel cerebrospinal fluid flow. I want to feel, does the brain have the ability to go into rhythm, or is there some structural tension that inhibits it from reaching its full expansion and retraction? Again, those are the terms we use in the Barral world. So I put my hands on his head, and really there's no rhythm. It really is just, I can only give you one hand here, but almost, it's not swirly, but it was just this dysregulation is what came to me. As I put my hands on his brain, like just there's such dysregulation in the brain, which again, absolutely think about it, right? He's not able to get in and out of his sleep cycles. He's not able to regulate those. So I didn't quite say that right away. I said, I'm just gonna be quiet for a little bit. I want to feel this. So from there, I just came into listening. Listening took me, not initially, actually, I think listening actually took me into the brainstem. I came into cervical spine again, fluid dynamics, cerebral spinal fluid was not amazing through there. But we came into the brainstem. So he took me into the brainstem. And again, I'm just listening and following. And there was, we dove into brainstem and then we came out. And again, this is all with our hands again, trained hands. Our hands are exquisitely trained. I see the princess and the pea. Again, we can feel through, we can feel fluid dynamics, we can feel electrochemical. We just, what a trained hand can feel. And again, this is all properties of physics, right? Fluid dynamics, positive, negative electrons. It's all physics of my body and my patient's body. Fluid dynamics, electroconductivity, right? So that's the level that we are trained, and then the sensitivity that our hands are trained in. So I ended up, actually, we came into actually to cranium bones, and I was in the frontal, and frontal needed a lot of decompression of the frontal nasal, and he did have an injury to his nose. I believe he broke his nose. So there was the need for decompression at the frontal nasal region. So as we get into the frontal nasal region, we think about a little bit deeper. We got pituitary, we got hypothalamus, and pineal is further back. So as I'm treating his brain, I'm thinking about mitochondria. How's the health of his mitochondria? Do we need to support mitochondria? How is, actually from there we went into, with my hands, there was this, and I'm just going to say, I just explained what I feel with my hands, this in, out. So as I'm on his frontal, his glabella, his frontal, that frontal nasal region, again, I'm feeling, it wasn't really low, kind of in between frontal nasal and just above, kind of superior glabella. But there was this in, out rhythm. And as I felt this in, out rhythm, again, the rhythm wasn't normal, healthy rhythm. It was also almost I'm a stuck rhythm, or I'm a rhythm that can't quite do my job well. So when we think about the work we do in the brain, we work structurally, and then we work electrochemically, and fluid dynamic wise, to encourage pathways. So again, everything that happens in your brain, again, there has to be structural clearance. Like, you have to be able to get through the tissue fluids, and the messages through the nerves. The neurons have to get through the tissues, and so our job is to make sure we use our hands to enhance those pathways, both structurally and then functionally. Can we encourage those pathways through the fluid dynamics and the electroconductivity of our hands as well. So feeling that, and actually it was great, because I was sitting there, I was asking the patient's mom, like, hey, can you look up L-carnitine? That is a supplement that is involved in lipid synthesis. We get into the Krebs cycle, and often as a supplement that many people are deficient in, that has to do with cellular health, mitochondrial health, and we also support to be able to the omega-3 pathways as well. So all of that. So thinking about, again, just that concept for him. So I'm asking mom to research, hey, is there any research that, is anybody doing research on L-carnitine and narcolepsy? So, she's doing some research, she pulled some things up. So we'll explore that. We have questions, is this something that can help this patient, and who's looking at these other things? So then, again, back to this in, out, I immediately thought, okay, we've got hypothalamus and I've got pituitary. And in our endocrine work through the Barral Institute, it's important, imperative that we have balance, that the communication between pineal, pituitary, and hypothalamus is good and continuous and smooth. And it wasn't erratic. Erratic wasn't the word, but just this in, out, again, dysregulation. It wasn't able to regulate well. So then the question I ask is, hey, is anybody doing work on pineal and melatonin, right? What's going on? How does melatonin play a role in all of this? Does it play a role? Again, a question just I'm posing, for the doctors, for the people who are researching narcolepsy. So, I had my patient's mom, hey, start researching that. So again, I need to go back and see, what she pulled up research-wise, but we found some literature that talked about hypothalamus and pineal. So my job there was just, hey, how can I encourage healthy functioning of pituitary, pineal, and hypothalamus? So that was what I worked on, is just working on the rhythm to restore more balanced rhythm so that communication is more efficient. So as we did pituitary, I got in pituitary as well, and so I described, hey, here's the endocrine system. Another question I had, which comes from my functional med eyes, is cortisol. So what's going on? How does the brain chemistry affect the cortisol? How is cortisol contributing to the brain chemistry? Because in functional medicine, we look at the salivary cortisol profiles, and when people have trouble sleeping or they have trouble with arousal, is that cortisol super high where they can't downregulate and come into sleep and rest? Or are they low cortisol and they just don't have enough to bump up? Because it's interesting. So he would wake up, he would have breakfast, and then he would need to fall back asleep within an hour. And then he could start his day. So that made me think about cortisol. So again, working with this doctor, hey, could we perhaps look at salivary cortisol? We're just curious, right? What are these other pieces, chemistry-wise, that we know affect the brain? So that was the work that we did. He's a college kid, so I won't see him again until spring break. But absolutely, hypothalamus, pituitary, pineal were significant players for him. So as I treated those structures, we did some decompression of the frontal nasal, restored some of that. So the question is, right, given here we have this pathology, will that support the production of the chemicals needed to help him with his sleep cycles? We will see. I encourage him to get the Oura Ring because it does a great job of tracking sleep in it, so I don't have mine on. It's charging. It's so simple, again, versus the Apple Watches, the Fitbits that are buzzing in your ear. This ring just sits on your finger. It's so benign, and it's really pretty. Looks great on guys too. But it does a great job of tracking our sleep. So I encourage just, not to be neurotic about it, like, oh my gosh, how's my sleep? But just to notice patterns. Hey, are you getting into the deeper sleep? So again, we talked about how important it is for that deep sleep, for that healing, that restoration and healing of all the body's tissues. So I just wanted to share a fascinating case. Again, I was very honest. I didn't know. Help me learn about narcolepsy. Here's what I'm going to feel with my hands. Here's what I know about the brain. Here's what I know about functional medicine. What can I find? What does it feel like in the brain when we have this disorder? And perhaps what can we do? What can we do to support those pathways, support the brain, support the health of the brain through the